So are there any other strategies that you found particularly useful over these years to help people
Well, I
recover from?
think we have to mention this. If you're living in a very moldy house
Hmm.
and your family is very sick, and you, or even if it's a moderately moldy house, your child's sick with asthma twice a week, there are ways of treating it actually with allergy extract. Some people don't know, but there's a type of allergy extract treatment that I think is one of the best hidden secrets from the public, and it's a real shame, and it's called provocation neutralization allergy testing.
Hmm.
You can put a drop of a mold mixture in somebody's arm that looks perfectly normal, and if they have asthma, you can produce asthma in seconds. Within 8 minutes, they will be sick, and you can produce headaches, and that's why they call it provocation. You provoke the actual symptoms that the mold produces. So if molds cause you to have a headache and fatigue, you put in a drop and you're going to have a headache and feel tired. If it causes hyperactivity and asthma, you're going to have those symptoms. If it causes itchy skin, you'll have itchy skin. And then if you give that patient increasing dilutions, so you give them a 1 to 5 and then a 1 to 25 and then a 1 to 125, one drop of that allergy extract in the right dilution within 8 minutes, that patient is entirely normal. Now the problem is that there aren't a lot of doctors that know this kind of this technique. Your insurance may not cover, and trust me, the insurance companies decide what kind of medicine you can get in this country,
Yes.
because many, many more people would go to provocation neutralization if they didn't have to pay it on their own, because it's so effective. It enables you to put drops on your tongue or give yourself an injection of the right dilution and stop your symptoms. That's why it's called neutralization. It neutralizes or stops your symptoms. And therefore, there is a treatment. Traditional allergy treatment also works. I did that for over 20 years. You can give injection, gradually increasing amounts of a mold extract, and eventually many people will get well. But sometimes that method doesn't work, and it certainly doesn't work as fast or as quickly as provocation neutralization. As soon as you find the right dilution to clear up that person's symptoms, they can take a few drops under their tongue, or it's so safe they can inject the extract in their arm, and they will improve dramatically within a very, very few minutes.
Yeah, let me just highlight a few of the points that you mentioned too, because we used to do that in our office too, until a few years ago when the insurance companies essentially blackballed our office from receiving reimbursement for this service. But the primary difference, the way I explain it to patients, is the provocation neutralization or PN testing is really a quantitative assessment, whereas traditional allergy testing, like you used to do, and I say 99% of allergists do, is really more qualitative. When they do their test, the only answer you get on the initial testing is you are allergic or you aren't allergic. They don't tell you how allergic you are, whereas PN testing does this serial dilution to tell you precisely how. And the downside of that, it takes a lot more time to diagnose someone, perhaps 4, 5, 6 visits or more, depending on how many items they're testing for, and each visit is a few hours. But the benefit is that you get almost immediate improvement, and you don't have to. There's no danger or risk because you're not getting these progressively increasing doses that have to be administered in a doctor's office. The dose that's given is like the perfect dose, and it can be safely administered at home by the patient. So you save a lot of time, effort, and energy there. And in my experience, is it's a lot more effective. Yes, they both can work, but PN testing probably works over 80% of the time, whereas traditional testing probably works less than 20%. At least that was my experience. And you having been a board certified allergist and really both methods, I think you might be able to comment. But I'm sure you can comment more accurately on than my experience. But I'm a really phenomenal fan of this, and someone who's interested in that, there is a whole academy, the American Academy of Environmental Medicine, that has a website that you can go to, and you can find the people who provide the service that are close to your area.
Yeah, I feel very, very badly that the insurance company regulates the kind of medicine that we can practice, because if they don't reimburse for it, most people do not want to pay
Yes.
out of their own pocket. And the thing that amazes me is some people will continue with medical care for 20 years and they know it doesn't help, because they're paying for it. They're continuing it mainly because the insurance company pays for it. They don't want to spend the money to get provocation neutralization allergy testing, which could make them better. I've seen patients that could barely walk in the office, and with it by noon they're well. You've already figured out the major things that cause problems. You've treated them. It can be that fast. And if you start to develop symptoms, once you have your treatment dose, you put the drops under your tongue or give yourself a shot, and you're fine within a few minutes. And to think that the insurance company is fixing it, that you cannot get this kind of medical care, and it just means that the traditional allergist in some way I believe they got to the insurance companies and said this or this. Someplace somebody put pressure on the insurance companies so that they won't pay for this. And it doesn't make sense, because I should think, why wouldn't the insurance company want to give you treatment that would make you well right away, because it saves the insurance company money. Their bottom line is money. How can we save money? Our bottom line is, how can we make you better? Here's a way that's expensive because it's time consuming, but it is a gift. Once you find that dose, it works like a miracle.
Yeah, well, the issue with most insurance companies is they're very short-sighted, like most businesses in the United States, at least, in that they're only looking for the immediate component. So they'll use any excuse, justification, or method they can to deny coverage for anything, because this type of testing isn't really accepted by traditional conventional physicians. They use that as their justification to deny coverage, and therefore their immediate costs go down, even though their long-term costs go up, because these individuals have to seek alternative cares, which are almost invariably more expensive in the long run.
If you want to see some actual videos of provocation neutralization being done, look on my website, drrapp.com, drrapp.com, and I have a whole DVD on reactions to molds, showing the variety of reactions that people can get, children and adults, if you put a drop of an allergy extract in their arm for mold. And then what happens to their handwriting. We have the before and after, how they look and act and behave and write before, and then I put a drop of the allergy extract in and show that we can make them sick. And then we give them the neutralizing dose, and then I have another video showing how they look after the testing is done. And this is sometimes all that is necessary to convince somebody that maybe they don't have to live forever using one drug after another. Remember, when you have an allergy, it's like having a nail in your shoe causing a sore in your foot. You can put on a bigger bandage. You can take drugs, one drug after another, several at one time. But the ultimate answer, if you've got a nail in your shoe, is to take the damn nail out. And this is what we have to convey to people, that taking one pill after another is not resolving the problem. Figure out why you are sick. What did you eat, touch, or smell? Get rid of the cause if you can. If you can't, then get a treatment that works. If regular treatment works, fine. But if you're relying on drugs, you'll be taking the drugs 20 years from now, and you might just be sleeping on a feather pillow or drinking milk every day, and that's what's causing your symptoms. Wouldn't it be better to get rid of the feather pillow or stop drinking or eating the food that's causing the problems?
Yeah, certainly makes a lot of common sense, but sometimes it's lacking, of course. Common sense is as common as we'd like it to be. So it's a far more effective strategy to employ those recommendations than the ones that are traditionally used. So do you have any other words of wisdom and guidance for people who struggle with these issues?
I was talking about foods and the fact that soy and mushrooms and other foods may be contaminated with molds, like old tomatoes might have aflatoxins or various chemicals on them, and mycotoxins or mold toxins on them. And these can make you sick. But let me tell you, the problem that we're all faced with is we have many, many sick people who don't have much money. They can't afford to go to an expensive doctor. They can't afford to have expensive testing. What can we do to help them very, very quickly and inexpensively? Well, let me tell you, if you've got allergies in your family and you have allergies such as hay fever, asthma, and nose allergies, the major cause could be dust, mold, pollen, foods, or chemicals. What can we do to get rid of these things all on your own without it costing you an arm and a leg? Well, you can go on a one-week diet. It's in all my books. It's on my website, drrapp.com. And basically, it takes away the highly allergenic foods for 1 week. If these foods are causing allergies, the first 1 or 2 days you might have headaches, feel tired, have a bellyache, but by day 5 to 7 on that diet, you might feel better than you felt in 20 years. And the second week, you add one food back every morning on an empty stomach all by itself. And you wait and see what happens. You add back milk, what happens within an hour? The next day you add back bread or cake, what happens within an hour? The next day you add back 10 sugar cubes and see what happens. And by the end of the second week, you know not only which foods cause trouble, but which symptoms they cause. The tip here is if you develop symptoms from a food, take 1 to 2 teaspoons of baking soda and alkali again. We mentioned how important alkalis are. And many times the symptoms will disappear in a few minutes.
Yeah.
This is a way of solving food allergies or diagnosing food allergies within a week or 2 weeks and not costing you a penny. Now, how can you get treated?
Well, but before we leave that, let me just expand on the diagnostic component because there are some new technological tools that may even simplify that. You know, I'm a really strong component of exercise, and that's one of the reasons why you're still doing so well. You are too, and aggressively implementing that in your own life. But there's some new interventions like high-intensity interval training that really require the use of a strap-on monitor on your chest or even on your pulse, and you can with a simple watch you can digitally display what your pulse rate is. So you don't even have to measure it because, there's some variability in whether you're counting correctly, but the electronic ones are typically more accurate. So it's a really powerful innovation, and you could get 2 uses of it. You can use it for your exercise program too, and you can use it for your food allergy diagnosis. So can you just mention again what the increase should be? So if say your resting heart rate,
if your resting pulse is a regular 80, bum, 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 bum.
Yes, or 70 or 60, whatever it is.
Yeah, it can vary from 65 to 85 or 90. But if your pulse is suddenly over 100 per minute, and or it becomes irregular, it's not bum, 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 but bum, 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 bum,
sure.
bum, all over the place. It means that your heart, as I said, has gone into an alarm state, and it's telling you that it's possible that it's something you ate, touched, or smelled. And some people think a cardiac arrhythmia, a regular heartbeat, or a high heartbeat is normal for them. No, it is not normal for them, okay? It's not normal to have a heartbeat of 120 that's irregular. It's not normal in my mind to have a heartbeat over 100 that's irregular. And frequently I've found that molds or foods or pollen or dust, all of these things, chemical smells, can all cause drastic changes in